Hello everyone. This is going to be my answers for the case of Felicia. The first question being what aspects of Felicia's family history can in part explain Felicia's dependence on substances? I say after like really reading and analyzing her whole entire case, I can say that she grew up surrounded by like a lot of substance abuse. Um, Her mom abused drugs. Her father was um, always incarcerated for drug related offenses. She also experienced like a lot of sexual abuse. She also experienced just like a lot of neglect and just her being in the foster care system and being separated from her sister. And I feel like those childhood experiences, I feel like those pretty much contributed to her like emotional state and just like how she copes and just like her unhealthy coping skills, which more so really increased her risk for wanting to use and whatnot. For the second question, what additional information do you need to gather to determine whether Felicia has a substance use disorder based on DSM-5? I would want to just know like where she first started to use drugs and alcohol, how often she uses. I would want to know how much she uses. I would want to know if she experiences like cravings every now and then. I would also want to know just like her tolerance level, like if she's developed like some type of tolerance, really. Um, if she does have like some withdrawal symptoms. I also would just want to know like just about previous like treatment attempts, like how, you know, if her getting treatment that's been a thing for her in the past. Um, Also just I would like to know if she went through like thing of being sober. Um, and also just I would want to know how her like substance use has affected just her work ethic and how it's affected other things like her personal relationships and um, her finances and just how she just functions on the daily. Um, and I feel like that information it would really help determine whether she even meets the criteria for DSM-5 and just the severity of just her disorder really. For my third question, are there any other mental health issues that you think Felicia is experiencing? Yes. I would say besides anxiety, I would say that she also might be struggling with like some trauma related issues, from like her childhood and stuff, and just like her being abused and just going through the neglect that she went through, during her childhood. She also may like be depressed because of like everything that she's like been through. I think that a full like mental health assessment it will really help determine whether she meets the criteria for like PTSD or like depression or something like that. Um, for when was Felicia's last medical exam and why is this important to find out? So when I read the case, it didn't really like say when her last medical exam like happened. And I feel like that's important because long term substance can long term substance use can affect physical health, and then it can affect things like your liver, the heart, the brain, and just how you function overall. And so I feel like a medical evaluation can also just identify like certain withdrawal risks, pregnancy related issues, since she recently gave birth and any other like medical conditions that just need treatment really. um Number five, what biases might you have based on what you know about Felicia and her situation? I would say at first it was definitely easy to judge Felicia for leaving her children alone and also just her driving while drunk. It was definitely easy to do that. I would also assume that Felicia is somewhat like irresponsible and like she doesn't really care about her children. However, comma, uh, we had to recognize this as like personal reactions and remember that addiction is like a disease. And so over time, that often just develops alongside some trauma and like mental health problems. And for my last question, how might these biases influence your work with her if they go unchecked? If my biases just so happen to go unchecked, I would definitely become less empathetic. Um, make yeah, I could become less empathetic, and I could make some unfair assumptions and only focus on her mistakes rather than her actual strengths. And it could most definitely damage the therapeutic relationship that I built with Felicia, and it would make it harder for her to trust me. And as a social worker, it's very important to remain objective and to just practice the cultural humility, and use like a more trauma informed, like strengths based approach to help her support like her recovery, and also while just making sure her children are safe. So